and the emergency declared under Chapter 12 of Minnesota statutes. Under those very rules, in the open meeting laws, we are able to meet virtually, and this meeting will be conducted in that manner, and all votes will be counted by a roll call vote. At this time, I'd like to recognize Minnesota Department of Health Commissioner Jan Malcolm to request an approval of Executive Order 2122, extending COVID-19 peacetime emergency declared under 2001. Commissioner Malcolm, you are recognized for as much time as you may consume.
Thank you, Governor, and good afternoon, members of the council. I am here to respectfully request your approval of the extension of the peacetime emergency. You're very well familiar with the history, the fact that the peacetime emergency was a vital tool for all 50 states and still in use in 45 of those states. Since the Executive Council last approved the extension of the peacetime emergency just in the last month, we have continued to see a significant number of cases in Minnesota, hospitalizations, and unfortunately deaths. We are making good progress. The rate of case growth, the rate of hospitalizations does continue to come down at a steady but fairly gradual pace. The big job right now, as the governor has said, is to continue being able to use the executive powers conferred by the peacetime emergency to pivot quickly, to keep on testing, and to evolve our vaccination strategy as needed to try to keep the pace of vaccination up. We still are in a race against the variants, so it's critical that we continue to make good progress on vaccinations, and the executive authority has been just instrumental in our ability to stand up, deploy, and reposition both testing and vaccination to fill critical gaps. I think you are well familiar with the rationale from a public health standpoint. Would be happy to answer any questions you may have.
Thank you, Commissioner. And I too would note that the moves that we've made over the last several weeks because of the progress around vaccinations, that progress highlighted by President Biden, puts us in a good position, but not done. And we have a lot of work to do, especially around vaccinations testing. And of course, there's the practical matters around federal emergency aid is dependent on being in the emergency situation. And so I would ask if there's any discussion surrounding Executive Order 2122.
Yeah, Governor, this is Keith Ellison.
You're recognized, Attorney General.
Yeah, I do want to say that I want to commend the administration, your administration, and Department of Health and steady progress on vaccinations. I do, however, note that first and second vaccination shots vary widely from the standpoint of race in our state. And I'd like to know from the commissioner's standpoint, how can we do a little bit better in Black and brown communities to get those vaccinations out? And what are we thinking about and making sure that we have equity in that area?
Commissioner, I will turn to you, and I want to assure the Attorney General this has been centered in our process around vaccinations. Dr. Chimello helping lead that up, and several weeks back, Minnesota made a pretty pivotal move to 40% of the allocations going to communities in high social vulnerability indexes. That ratio actually put us at the top of all states in the number of vaccines. And then I'll let Jan talk about a bit of the strategies around this. And we are seeing a closing, but the Attorney General is exactly right. There are still gaps in that equity. So, Commissioner?
Thank you, Governor. Thank you, Attorney General. The setting of that goal was very important and to say it is our goal to close the gap. And Social Vulnerability Index stands up as a good tool to capture a broad range of health inequities. We are measuring the progress. We are reporting it publicly. At 2 o'clock today on the MDH media briefing call, Dr. Chimello and I will be updating on the strategies and the progress. basically the strategy is just to increasingly get the vaccination deeper into the communities, partnering with trusted community-based organizations, Black pastors and the like, to sponsor more localized, easily accessible clinics for the populations that have not been well reached by some of the mass vaccination efforts. It's going to be an ongoing process. We're not stopping when we hit 70%. We're not stopping until we have closed those gaps that you rightly point out. The mobile vaccine buses that are now deployed have been quite successful in getting deep into communities and again, working with community-based organizations to really invite and support their community members to come and get vaccinated. It means a lot more when the community leader hosts it and helps people sign up than it does for us to just kind of put the generic call out to come to our state sites. Now that the FEMA site at the state fairgrounds has been incredibly successful at serving some of those previously unreached communities. So I think we are making progress, but definitely a long ways to go, and our commitment is to keep those efforts up.
Well, thanks for that report. And I just want to say that I stand ready to help in the effort to get the word out. So feel free to call on me if you think I can be helpful.
Governor?
Yes, you are recognized, Lieutenant Governor.
Thank you. I just wanted to speak to Attorney General Ellison's question. I think, Commissioner, what you laid out is exactly right. And I think we are moving from a place where we're looking at large scale events to smaller, more personalized ones. Just this past week, I know that our vaccination, our mobile units started vaccinating migrant workers. And, that is an important piece of how we're going to ensure that folks receive the vaccine. We've continued to lift up organizations like Unidos, which, Jessica Velasco, who's going literally door to door, having conversations with neighbors about the vaccine, its safety. We now will have some of the trusted folks in the community and pediatricians who are helping to have these conversations with families for folks who are getting vaccinated 12 and up. So really what this is turning into, Attorney General, and I know that you know this better than anybody, is really an organizing effort. And that is where we find ourselves. So you bet that we are going to call on you for additional opportunities to do this work together across the state, because it's going to take those personal conversations and, as good organizers, removing as many barriers as possible for folks to participate through transportation, issues of when and where these are happening for second and third shift workers. All of those ideas have to be on the table. We are implementing them, but we have to do more. So your question is well received, and I appreciate it.
Governor, if I may just thank the Lieutenant Governor for supplementing. This is an urgent thing, and we all know that, the socially vulnerable communities of color, low-income communities were hit harder by COVID-19 disease. And so I appreciate the extra effort that everybody's putting in, and I hope our friends in the press will help us continue to get the word out. But Lieutenant Governor, thanks for supplementing there. It's really helpful information.
Thank you.
I want to thank you both and associate myself with that. I would note to the Executive Council that we're going to, in a minute, take up a second motion around masking and CDC guidance. There are those that would claim the vote we're going to take now is no longer necessary, the emergency over. I would note that if we did not have these emergency powers, the FEMA site would close immediately. All of the work we're doing around equity would cease. The folks that have been brought in from other agencies in state government to help assist this would be then immediately moved back to where they started. And $40 million in supplemental nutrition programs to people hit by COVID would end. So of those who ask, why do we need the emergency powers in place? Because it triggers those major issues that have just been brought up. So I'm really grateful. I know we've asked this of this Executive Council many times. I'm just grateful for understanding, especially those hardest hit, like the Attorney General and the Lieutenant Governor are talking about, need these emergency powers to make sure that they are prioritized, taken care of, and and lifted up by the state, and that's our responsibility. With that being said, I would ask for a motion to approve Executive Order 2122.
So moved.
And I'll call roll call vote. Attorney General Ellison, how do you vote?
Aye.
Secretary of State Simon?
Aye.
Auditor Blaha?
Aye.
Lieutenant Governor Flanagan?
Aye.
And I, Governor Walz, vote in favor of the motion. The motion carries. Executive Order 2122 is approved. I'm going to call again to recognize Commissioner Malcolm to present a request on Executive Order 2123, amending Emergency Executive Orders 2051, 2081, 2111, and 2121. And this will deal with the masking mandate and guidance from the CDC. Commissioner Malcolm, you are recognized for as much time as you may consume.
Thank you, Governor. As the governor indicated at the start of the call, this executive order is prompted by CDC's guidance as of yesterday afternoon, that it is now, the data are abundantly clear that fully vaccinated individuals are extremely well protected from both acquiring the virus and transmitting the virus in a wide range of settings. And so their guidance is that fully vaccinated people are essentially free to return to pre-pandemic activities without restriction, with some exceptions where there are federal requirements on public transportation, which will still require masking. But it's just really important that we be clear with the public and with the Executive Council. The CDC's guidance is that unvaccinated people should still be using all of those public health precautions, including masking and social distancing. And that will remain the MDH guidance as well. But this health guidance does not have the same force of a legal mandate. And I think the governor explained well in his comments why we don't think it's possible to craft an order, an executive order that targets only the unvaccinated for a mandate approach. But we will continue our best efforts to educate and urge unvaccinated Minnesotans to still take those precautions. The order also clearly lays out that local jurisdictions and others are free. Businesses are free to impose those policies as they see fit. Nothing in this order prohibits that. And the bulk of the order just details those components of existing executive orders that are being modified to remove the mask mandate from the orders that do continue in place in most cases until May 28th. The social distancing requirements, the capacity limits on businesses that were announced just a week ago remain in effect until May 28th. But the mask mandate is removed by this executive order from those other orders. I would be happy to answer any questions you may have.
Thank you, Commissioner Malcolm. Any discussion or questions from the Executive Council regarding this executive order?
Governor, I do. This is Steve Simon, if I may.
You're recognized, Mr. Secretary.
Thank you, Governor. First, kudos to you and Lieutenant Governor and your team for being nimble and doing, as you have so often over the last year, showing that you can pivot quickly. And I know that this came up rather suddenly, this CDC guidance. So I know that many folks are trying to sort it out. But Commissioner Malcolm, I just wanted to ask you, there's been a lot of reporting of people's anxieties, let's say, in the last less than 24 hours about the fact that unvaccinated people are encouraged to wear masks, but they might not for at least two reasons. One is the stigma of walking around and advertising that you haven't been vaccinated. And the second is that there may be substantial overlap between those folks who are unvaccinated in some places and folks who are mask skeptics to begin with. Could you just comment on that? Because I know, generally speaking, in the public, there's some concern about that. Obviously, you concluded and others have concluded that it is worth the benefits. But I'm just, if you could just comment on that for the record.
Thank you, Governor and Mr. Secretary. It's an understandable concern that members of the public have. And again, we think that it's going to be just essential to keep on giving clear advice and continuing to explain to Minnesotans the degree of risk that is still out there with COVID, and to really implore Minnesotans to act in the interest of the community, to continue to take this seriously, and above all to get vaccinated. And we know we have a job to do there. We know that the folks who remain unvaccinated are not all monolithic group. They are they come from different perspectives. They have different issues. So we will continue to not shame people, but to try our best to get them the information they need to make fully informed choices, and to make it as absolutely easy as possible for them to get vaccinated, so that access is not a barrier. We think, we're at levels of vaccination now that are very helpful, very protective, especially to some of our most vulnerable. But as the Attorney General and Lieutenant Governor have mentioned, that is not uniformly true. We need to continue to be very focused on communities more at risk. But it's a good thing that, for example, we're getting close to 90% of all people 65 plus. And that equity gap is lesser in the elder population. So that's a good thing, that we've got a substantial amount of the population vaccinated, but we cannot stop and won't stop. I think that it was the practical decision on the mask mandate, was that it just was not going to be possible to apply to keep applying a state mandate when CDC had made such a broad and inclusive shift in policy. And as we've talked about, not operationally possible to separate out the vaccinated from the unvaccinated to try to enforce a mandate.
And just, if I may, Governor, just one quick follow-up, and happy to continue this offline as well, but as long as we're in a public hearing, I assume that at some point, though this was a pretty sudden announcement, I totally understand, there will be maybe some further guidance about the state workforce. Because although a mask mandate is not required, I hope and assume there will be some guidance as to public employees and proper use or circumstances there.
Well, Jen, yes, the answer is yes, and I appreciate it, Mr. Secretary, and I think you diplomatically explained to this, and I think it's, the CDC, and they're busy, and they came out and they put this information out quickly as they could, but we had laid out a pretty clear plan, a glide path. We're moving towards that, but we respect the science that was behind it. But you're right. There's some things we felt the need to get this out to the public as quickly as possible to set the state. And then to now we'll see counties. I saw Best Buy, Target, some private businesses will start clarifying their positions. So the answer is yes, we'll start getting more clarification in those workplaces. And of course, I think it's always important to stress for workers that in Minnesota, we have very strong protections that if someone doesn't feel safe or feels, especially in a workplace situation, they can speak up without fear of retribution. Auditor Blaha?
Yes, thank you. And I will be voting yes on this today, but that doesn't mean that I don't think your original plan wasn't better. The 70% much clearer, made a lot more sense as a community-wide approach. But at the same time, the horse is out of the barn, and we've got to do what we've got to do. We don't want a situation where a mask mandate would cause more confusion than compliance, which will not lead to better health outcomes. But I think it's also a good time for us to remember that now that we see the tool that a mask can be, and as someone who spent a lot of time in the hospital recently, I hope we do see some long-term changes with that. I mean, if you're going into a hospital as a visitor, why not wear a mask? You're visiting your friend who's got a compromised immune system. You've got a mask. It's a good idea to wear it. So I think that we shouldn't drop the idea this is a tool that will help community health long term, and that people should keep their masks around. You might be able to use it to help protect a loved one.
No, well said, Auditor. I think you're right. And I think you're right about the confusion piece of this. Keep in mind, too, that that I would assume that most health locations, clinics, hospitals, long-term care we'll continue to do this. As we said, private businesses have every right to do that. And then, of course, our safe learning plan stays into effect until the end of the year for our littlest ones. So you're right. I appreciate what you're saying. The CDC moved. As Secretary Simon said, we've tried to be nimble, follow the science. COVID's a learning experience. It's amazing how much more we've learned from last year, but I think your advice is right. And I think this is where we need to show understanding as Minnesotans. If people are choosing to wear masks, they wear masks, and that's the way it'll be. I think many of us will be wearing those if we get back on airplanes again and things like that. So I appreciate that guidance and those thoughts, Auditor. Lieutenant Governor Flanagan.
Thank you, Governor. I just wanted to build on what the auditor just said and Governor, what you just shared as well. The Safe Learning Plan is still in effect, which requires that within our schools, our students will be masked. I dropped off a second grader to school this morning. She was ready to go with her mask. All of the teachers and staff and other students were wearing masks, and I think that that's important to just remind people as this change has happened quickly. I also am the mom of a budding, public health professional in our 8-year-old who is very stringent about, these guidelines too. And so, for our family, we'll continue to wear masks when we're with her, and until she can be fully vaccinated. And that's what we're doing. And we'll check in with the summer programming that she'll participate in as well, to see what their guidelines are too. And I know, just for families, making the decision that's best for you and your families is important right now. And we're trying to put out as much information as we can to keep each other safe. So the recommendation continues to be that folks who are not fully vaccinated, including children under 12, right, should continue to wear those masks. And for our family, we'll continue to do that in solidarity with her.
Thank you, Lieutenant Governor. Well said. Any further discussion around Executive Order 2123 before I call for a motion? I would call for a motion to approve Executive Order 2123.
So
moved.
Roll call vote. Attorney General Ellison.
Aye.
Secretary of State Simon.
Aye.
Auditor Blaha.
Aye.
Lieutenant Governor Flanagan.
Aye.
And I, Governor Walz, vote in favor of the motion. The motion carries and Executive 2123 is approved. Before I ask for a motion to adjourn, I would just take a point of personal privilege to comment. I just got done meeting with some of our local public health here in Otter Tail County. I would remind us all, these are incredible public servants who for the last 14 months have kept their communities safe. They've gotten guidance on, they're trusted, they're in their communities. They passed along their incredible thanks and gratitude to Commissioner Malcolm for her belief in our public health system, for her belief in the county system, and for the guidance that they've been given. So I think as the Executive Council, if you don't hear it from the things that we do here impact Minnesotans, but folks who carry that out are local public health. They are true champions and heroes, and they passed along their gratitude, and especially to Commissioner Malcolm. So thank you for that. At this time, I would call for a motion to adjourn.
So moved.
I now call roll call vote. Attorney General Ellison.
Aye.
Secretary of State Simon.
Aye.
Auditor Blaha.
Aye.
Lieutenant Governor Flanagan.
Aye.
I, Governor Walz, vote in favor of the motion. This meeting of the Executive Council is adjourned. Thank you, everyone.
Thank you.